Now I request Dr. Doipan Mukherjee and Dr. Ritu Seth, please
ঋতুকে এখানে বসা।
take over the session.
Good afternoon all. I know this is a very
Attention, please, quiet please.
I know this is a very tiring thing. You have lost this habit of so many classes back to back, that to be for 2 hours, and this is the only session not related with the actual subject but for the examination. Along with me I am having Dr. Ritu Seth. She is editorial board member of our AY journal, and also she is our first lady, wife of my dearest friend in AY, Dr. Kaushal Seth from Mumbai. And I just want to share another thing. Ritu is one of the most suitable person in this session that is not related with ENT. I just want to share one personal information. The Kaushal and Ritu's son admitted last year in Bombay IIT. So Ritu knows better than anybody of us how to groom a child for ultimate success. Now Snehashish gave the responsibility of this session to me. I was not a very good student at your age. Though right now I am in medical education service, I am professor for last 8 to 10 years, but again I have realized why Snehashish have chosen me for this session, because a student like me, if in this age of life after 50 years can do something in teaching, then I can suggest something about you regarding examination. Now, can anybody tell what is the basic difference of you, the third year PGTs, and the teachers in this side? Anyone? Anyone? Take a mic. মাইক কোথায় গেল রে? এত সবাই বলছে, জানে ডিফারেন্স কি? Anyone stand up? Experience. Okay, so my take is the difference is only 3 months. So after 3 months you will pass your MS examination and you will be on our side, and on any day I can challenge that you have more recent information, more knowledge than many of the teachers, because you are right now in this process of learning. Now some other points. Though these 3 months difference is looking like a very shorter period, but this is very important period for your purpose. Why? Because after these 3 months all the students present here may have different growth trajectory in your career. Somebody will venture for a successful practitioner just like Dr. Dulal Bose, aura in practice. Somebody will pursue for medical education service like Dr. A.M. Shahar, Dr. Amitabh Rai Choudhury, Dr. Malik, and big teachers. And some of you may pursue for the corporate life, that is in corporate hospital with some amount of teaching with DNB students. So there are different aspects of life after 3 months, but these 3 months are crucial for all of you, because many of you will not touch your textbook, your theory book after 3 months. So try to do everything, every effort in your life for coming 3 months. This is the basic thing. Myself and Ritu will talk about examiner expectation, West Bengal University of Health Science MS ENT final exam pattern, clinical case presentation format, high yield topics, Viva strategy, operative Viva approach, common mistakes, exam day tips and take home messages. Long list, but I will complete it within 10 minutes because bottom line will remain same. Theory. Practice previous West Bengal University of Health Science question papers for last 10 years and you will get close to 65 to 70% of your theory questions from this preparation only, and coming 1.5 months are very important because this is the time for the preparation of the theory. And when you will answer your questions in the theory paper, try to give structured answers, definition, etiology, clinical features, investigations, management, complications like that. And suppose among all these things you are having better knowledge for something, that is etiology or maybe investigations, but don't write so much in a specific point and very little in some other points, because if you are giving this information for a single point like clinical features, you will not get that much of number. Another thing is you should know the papers, 4 papers, each paper will have 10 questions and each question will have 10 marks. So paper 1 anatomy physiology of ear nose throat, paper 2 disease pathology of ear nose throat, paper 3 operative principles and paper 4 recent advances. But there is no fixed protocol, there may be overlapping questions. So try to prepare yourself for everything from paper 1. Otherwise you will come to your HOD or your professor, sir, university has put this question in this paper, that paper, but ground reality will not change. You have to answer those questions on that specific day. Now, I am telling some other facts. After 1.5 months, each and everybody present here will come to your HOD. Sir, halat bahut kharab hai, need some suggestions. Each and every institution, you will come for a suggestion. And your HOD, your professor may or may not be able to give that suggestion according to the institution. My humble request is, you should come to your professor, should tell this, sir, my condition is very poor, please give some suggestion regarding theory questions. In some institutions you will get it, in some institutions you may not get it. But my suggestion is, you should prepare for this suggestion, but that is not your ultimate aim, because if you can get all those suggestions questions, then it is fine. But after getting that question, if you are not getting the questions from that suggestion, you will be in soup. So don't have a prefixed mindset regarding the suggestion. Try to prepare yourself for all the eventualities, because this is your final frontier. This is for theory. Now Viva. Expect questions on anatomy of the temporal bone, larynx, nose, paranasal sinuses, surgical steps, complications and their management, recent guidelines, instrument and operative photographs. If you don't know any answer, this situation will come at the time of your examination. Different approaches with different examiner and different types of students. But this situation will come. You will not be able to answer everything. So, what will be your response at that point of time? I am not certain, sir or madam, but my understanding is, so you should approach this thing like that. This creates a much better impression than guessing. And believe me, all your teachers, Dr. Amitav Rai Chaudhary, more 99.99% subject matter known to him. Then also once in a blue moon, one patient may come to Dr. Amitabh Rai Chaudhuri. In a first instance, Amitabh Rai Chaudhuri also cannot understand the case. This is life and this is medical profession. So no one can learn or no one can understand anything and everything, but your approach will save you. That is also true for your examination. This is the marks difference of West Bengal University of Health Sciences for practical examination. Usually this will be the marks distribution, and Dr. B.K. Rai Chaudhuri sir, please give a round of applause for sir. স্যার আমাকে মার্জনা করবেন, আপনার সামনে আমাকে বলতে বলেছে হাউ টু অ্যাপিয়ার ইন এক্সামিনেশন। সো দিস ইজ দ্য মার্কস ডিস্ট্রিবিউশন of practical examination. I have taken it from Dr. Somendranath Bandyopadhyay, so most likely it will be a correct one. So long case 140, short case 70, another short case 70, thesis 20, total 300, and rest instrument, radio, osteo, chart, specimen, grand viva 100. With this single slide you can understand how you should prepare yourself for coming 3 months, because the bulk amount of another আমাদের পূজনীয় ডক্টর শান্তনু ব্যানার্জি স্যার এসেছেন আমাদের মধ্যে। So you will get the clue through this slide only. So you have to give much focus on your cases, because only cases, that means long case and short case, will have 280 marks. So if you are failed in long case or you don't have good exam for cases, it will be very difficult to pass. So give maximum amount of emphasis to your cases. Then viva, that is practical examination. Here also you should have a structured pattern in your mind. Start with a definition, then classify, next discuss etiology, clinical features, investigation, management and complications. This is a complete package. This is your responsibility to evolve like this, because the examiners will sit just opposite to your table. He or she can ask anything and everything to you, but this is your responsibility to guide your examiner regarding the questions. If you are facing the examination in an unstructured way, then the questions will also come on unstructured way. So this is the responsibility of the student to guide the examiner how the entire examination process will follow. If you don't know something, admit it honestly instead of guessing. And examiners usually appreciate structured thinking over random answers. Why? Because when we are seeing our patients in the OPD, first we have to take some history, and with history we cannot clinch the diagnosis. Then we should have examined the patient, then investigations, then management. So in our day-to-day life we usually follow this protocol only. So at the time of your examination you should follow this simple protocol. Another thing, as because right now you are flooded with informations, most likely you are having 12 hours, 14 hours reading time. After few days you will ask for your exam leave to your HOD, then you will be able to flooded with more informations. But I just suggest a simple thing. Don't think that your departmental proceedings regarding the patient handling is wrong. Whatever may be the institution, whatever may be the department, you are following in your own department, own hospital, just the right way. So when you are in examination, so please give a big round of applause for our Secretary Madam, our Vice President Madam, and our CEO and our Medical Superintendent of KPC Medical College. So these structured proceedings are very important for good examination. Clinical examination, this is mandatory. If you are not having proper knowledge regarding clinical examination, nobody will spare you, because this is the basic thing. You may not have good answers for the management, you may not have good answers for the investigation, but for history and clinical examination, you must have proper idea. So be confident with long case presentation, short case, otoscopy, nasal examination, indirect, direct laryngoscopy, tuning fork test, audiogram interpretation, CT, MRI of the temporal bone and PNS, X-ray and ENT instruments identification and uses. On exam day, stay calm and confident. That is very important, because this is the exam of knowledge. This is not multiple choice question answer. This is not an examination of precision. This is examination of knowledge. What you had done for last 3 years, that will be actually assessed. So this is not a multiple choice question pattern examination. Listen carefully to the question before answering. Don't jump. Speak in a logical sequence. আমার স্টুডেন্টদের আমি বলি যে জিজ্ঞেস করা হলো তোমার নাম কি, স্টুডেন্ট আনসার দিচ্ছে আমার নাম দৈপায়ন মুখার্জি, আমার বাবার নাম চন্দন মুখার্জি, আমার দাদুর নাম এই, আমি এখানে থাকি, আমি এইভাবে এই মেডিকেল কলেজে আসি। দ্যাট মিন্স ইউ আর ফেসিং দিস examination in an unstructured way. That means without receiving any questions from your examiner, you have answered at least 5 questions. So be precise. Answer only the specific question. Then only you can guide your examiner for the next question. Maintain good communication and don't rush. Candidates usually lose marks because jump straight to treatment without discussing diagnosis, forget anatomy, cannot identify instruments quickly, give unstructured answers. A calm systemic presentation often scores better than the trying to mention every rare fact. This last line is very close to my heart. I used to tell all my students, suppose at the time of your reading, cause of anemia, you have 20 points. 1, 2, 3, 4, 5, 6, 7, 8, 20 points. All are true. In day-to-day scenario, when you are in the process of this PG, when your teacher will ask, what are the causes of anemia? You can give answers 5. 1, 2, 3, 4, 5. That's it. But now you are reading so much, flooded with informations. So you know the number 20 points also. But at the time of examination and for your future purpose also, try to think about common thing, common disease, you will be commonly right. And if you are trying to think about rare disease, rare answers, you will be rarely right. So this is not only for your examination, but for your future endeavor also. Last 10 days before the examination, revise only high yield topics. Don't rush for the entire book. Practice one long case daily, because somebody may have CSOM case as long case, another student will get it as a short case. So prepare your cases and give maximum emphasis on cases. Revise all ENT instruments, revise staging systems. because you will not be able to manage on stage the staging systems. You must know the exact staging system. And most importantly, don't try to give a call to the SR of department at 1 AM or 2 AM. Dada, Didi, ki case admit hoyeche, before the examination night. Okay. So, you will give all your junior PGTs, senior SRs, what are the cases for tomorrow. Have a adequate sleep and calm night before the examination. Again, I am telling you, this is not a MCQ examination. This is the examination of knowledge you have gathered for last 3 years from your teachers, from your department. Thank you for patience hearing. And I will like to introduce Dr. Ritu Sheth. She is from Mumbai. She is editorial board member of our AY journal, and she will speak something, and I have already mentioned she has extraordinary credentials for this session.
Thank you, Dr. Dwaipan, for the warm welcome. We have very short on time, so we'll just try to cover the topic fast. So first, most important thing is that what he said was very important, that the examination, especially the practical examination, shows how you have worked hard entire your 3 years. Your entire efforts of 3 years is reflected in that 1 hour of practical examination. And it is very important that the eyes will never see what the mind doesn't know. So you have to be very well read, because otherwise you will never be able to answer the questions in the practical examination. And these 3 years are dedicated to our field of ENT. So each and every patient which comes in, admitted in the wards for surgery or for anything, all of you should have seen. Because if you have missed the cases when they were admitted, then during the exam you are going to flounder and you will not be able to explain the basic principles of management, okay? And so that is how you will be stuck. So we'll just go through the books very fast. So for otology, what books do you read? What are the reference books you all are reading? Any one person? Okay, I think I will only have to do it. Okay. So first of all, please make a list of the books. I hope all of you have read them. Okay. Scott Brown is your basic reference book. So all of you should have read it before going for the exam at least 2 times. And the most important book in Scott Brown is the rhinology book and the pediatric otorhinolaryngology book, okay, out of all the 5 books, okay. For otology, another book you can use is Shambog, and I hope you all are reading that. It gives you the basic principles of otology. For larynx, you can read Rob Smith. It gives you good surgical principles of larynx, and various procedures which are done in the larynx, especially chordotomy and lateral vocal procedures on the vocal cord. And then for other practical postgraduate books, you can ask your seniors what they are using. And for the scopies like direct laryngoscopy, microlaryngoscopy, the Jackson's book is very important, which also explains how to remove foreign bodies in ENT. Okay, for head and neck, Stelmaran is being used. And one student asked me a question, what book do we read for thyroid? So thyroid is a general surgery topic, so I would suggest that basic book like S. Das, for the examination findings, you have to read Bailey and Love for management of thyroid. Edward Nan for all the eye signs, because those are very, very important and they will be asked to you in the practical exam. How do you examine the thyroid? How do you approach a patient with thyroid? And for parathyroids, a little discussion with your medicine colleagues would be very important for you. Okay? And then any DNB students over here in the hall? Anybody giving DNB or all are MS students? Okay, so I hope you all will be giving the DNB exams, because I am a DNB teacher. The DNB exams are much tougher than the MS exams, and we have a separate paper on head and neck and a separate paper on recent advances. So, and because all my students have the same thing, they have focused all their attention on otology, and when it comes to head and neck, they are blank, because then they don't know how to read head and neck and how to see the head and neck cases. So you have to discuss these cases when you, as and when they come to your department. And these last 3 months, as he said, is also important. Every day go to your wards in the evening, see what is admitted, have a case presentation with your registrars, because the more you present, the more you will be more experienced in talking about the case. Okay. So in the long cases, as he said, 140 marks for the long cases. So a complete thorough examination, besides the place of stay, and the past history is very important. And plus you have to ask the community history also to look for any genetic disorders. In general examination is important because finally you all are going to take up the patient for surgery. So basic points of general examination should be covered. And an entire ENT examination is to be discussed in the exam. Even if it's a otology case, you have to see the nose and the throat, including the ideal. Okay? And for a long case, which is usually a year case, the TM finding drawings are very important, because sometimes if you have missed to say something in the exam, the examiner will check that what you have drawn on paper. Because unless you have seen those finer points, you will lose marks in the long case. Because sometimes I have students just making a circle with a handle of malleus and not seen any finding in the middle ear, which is can be disastrous for a long case. Okay. And in the tuning fork test, it is better you convert Rainey's, Weber's, absolute bone conduction is also to be done in all the cases. Okay. And preferably a Siegel's speculum if required. And for audiometry, I hope you are reading the book by Dr. Anirban Biswas, because many principles will be asked in that. And please spend at least 1 week in your audiometry department to learn about the basics of audiology and impedance audiology and BERA. Okay? Because they will come in spots. And the management you have to discuss as both medical and surgical management. Okay? Okay. What you can start doing is make a master diary for yourself, and whatever important points you come across each case, write it in that diary, so that just before the exam, 2 days before the exam, you can just go. Suppose if I have a year case, then these are the points I should know. These are the recent advances. And please focus on recent advances. The time is too short to go and read recent advances, but you can discuss with your lecturers and with your SRs and know the relevant recent advances for each and every topic, okay? Especially head and neck, otology and rhinology. Okay. And most important thing is the practice will make you perfect. So the more you practice talking in the exam, the more you have a better chance of scoring for the exam. So present more cases, present more long and short cases, so that you can speak fluently in the exam. Is there any other topic you would like me to cover? Anybody? For what? Practical? No, that is not required. You can use your basic pen and pencil. You don't need colored and all. You don't have time for that. But as we said, please see, please read first very well. Then only in the practical exam you will come up with nice finer points. And with all the colleges around, you see that you make friends with all your with all other people who are giving exams. So that if they also have any interesting case, it is important for you to see it. It is important for you to see a Dalrymple sign. It is important to see you a lid lag. Then only you will remember in the exam. Otherwise, you will not remember. Okay? And whatever head and neck cases.
Quiet, please.
Yeah, whatever reconstructions and whatever is being done in your hospital, go to other wards. Spend this time to do that. Because if you have seen it, you will always remember. It will just come in the time of the exam. Because just mugging, you will not remember anything. Okay? Discuss with your colleagues. Every day have a case presentation mutually. Discuss the instruments. Talk about the surgery. The more you talk, the more you will be able to say better in the exam. Okay? Anything else?
Ma'am, regarding the paper section, in the latest NMC it was written that third is recent advances and fourth is general surgery. Which one is the one we need to follow?
No, this is for which MS exam?
Yes, MS ENT.
Dr. Dwaipan will know about West Bengal actually.
Sir, in the NMC
General
one,
surgery paper.
the NMC one it is written that third paper is recent advance and fourth is general surgery principle.
Yeah. So I think as per the NMC criteria, what Dr. Dwaipan said is the first paper is basic, second paper is disease, third paper is primarily operative, and fourth is recent advance. But as of now, in West Bengal University of Health Sciences, we have been following the other way around, third paper is recent advance. Till this year, it will be the same. It has been changed. There may be some changes next year. Okay?
Thank you, sir.
So, thank
Yeah.
you, Dr. Dwaipan and Dr. Ritu.